So there's something about women. So that's why we don't have extra time to really go through what women go through and to also discuss it, to get more information about how to be a woman, a woman. Praise the Lord. Sorry, I'm going to praise the Lord. So today, before I invite my guest, I want to talk a bit about Dr. Rita is authority in medicine. She has treated women from different parts of the world that have issues with their bodies, ranging from puberty to menopause and all of that. And I've seen people who have testified to our wealth of knowledge and their improvement of their health after they had consultations with her. And she's quite famous for her teas. Rita has teas that can help you do a lot of wonders in your body. And you know, how being a pastor, I know that the Spirit God says, the Bible says, it says that God wants us to be in health, even as our soul process infection, right? And even don't know that Christ, went on the cross for us and took on the body of sin and our sicknesses, but we still also have a responsibility for ensuring that our bodies are kept in the right place. The other day I was talking to some of our brothers in church. I told her, I said, listen, you have to take care of that temple. The Rita's part is just rolling. Our network is not very, very okay. Yeah. But I'm sure she'll get on back with us. So you see, I was saying your body is a temple of the Holy Spirit. The Bible says keep it holy. That means it is your job, it is your duty to keep your body holy. So it's like you stand as a security guard over your body. You can't treat your body just like as you like. It's like if you have a car. If you don't service it, you don't take care of it, you drive it on bad roads, you might probably have some problems with the car. So also your body is your covering. It carries your spirit and it carries the Spirit of God. So you must be careful where you drive it to. You must be careful, what you put in it, because the food you eat ultimately becomes part of your body system. So you have to be careful of what you put in your body, where you go to, what you see with your eyes, what you hear, So as a woman, as a Christian woman, there are things that can plague women's body. We shouldn't plague us because actually we are of Christ and we have access to the divine life. But how come some women have issues in their bodies? So today we're going to be discussing about the things that happen to women: toilet disease, hygiene, how to prevent all of that, not just only for married women, but also for single ladies. Actually, for single ladies first, because a lot of single ladies, they have issues with their bodies. I have a friend, let me just tell you this story. I have a friend when she was quite young, when she started menstruating, she didn't know what that meant. And she told her mom told her that once you start menstruating, that means you can get pregnant. If a boy touches you, that's the end. You're pregnant. And she was like, she took all the instructions, really, really seriously. And mother said, no boy should touch you. And she was fine. Then she came back from school one day, that she was now in secondary school, and she was really crying. Her mother said, what happened? She said, she was crying. She couldn't tell her mom for a whole day. Till the next day, her mom was really wondering, because she wouldn't eat and she couldn't sleep. She was crying and just hold on a bit. Let's just see whether Dr. Rita is here. She's a pastor as well as a doctor, so that's why I will call her pastor and I call her doctor. Okay, so Dr. Rita, I'm just telling them about a friend of mine who started menstruating, and her mom told her that if anybody touches her, that's the end. She's pregnant. And when she came back home one day, she was crying. She couldn't eat, she couldn't sleep. And her mom was like, what's the matter? But in fact, the whole day she looked up. The next day, she was able to plug her to her and say, "Mommy, I'm pregnant." And I said, "You are pregnant?" He said, "I'm pregnant." I'm so sorry. I tried. I tried to prevent them from touching me, but I'm pregnant. So the mom was like, "Who touched you? Who touched you?" Anyway, she found that actually it was touch, it's physical touch. She thought she was pregnant. Now, that's why we are having something like this. Ladies, when you are married, or you have information before you think you have HIV. You're just having some symptoms and you think you have HIV. So that is why I have with me here today Dr. Rita. Dr. Rita Jambin, like I said, she is she's good in treating women matters, and she has this lovely tea. I wish I have it here. I would have just maybe she will have one day to show for you. You can see, you know, um, you know. Dr. Rita, welcome to the show. Welcome to this platform. Welcome to this.
Thank you so much for having me, Pastor.
Yeah. I was talking with you before we came on live about a lady who whose husband says that she's unfaithful because she has been having some symptoms in her body, you know, and she was treated. She's both of them are treating themselves. But I'm just going to ask you, when we have all these symptoms, is this always sexually transmitted? What do you have to say about that? Let's just dive into the topic, right?
Result of an infection. Sometimes, and not all infections are contagious for the woman. So there are different types of vaginal infection for a woman, and I've talked about several of them on my page, Ask Dr. Rita Show, but I'll just run through some of them. Bacterial vaginitis, or vaginosis rather, is a condition where the bacterial load in the vagina is much more than the normal. Now, this is a bacterial infection. So a woman can have this kind of infection and her husband will not have it because it is not a sexually transmitted infection. It is usually as a result of overgrowth of bacteria, and simple things that women do can make the bacteria there to join to become much more than the normal that they should be. So the normal body has bacteria everywhere. There's bacteria on your hair, there's bacteria on the face, on every part of the body that have the duty to keep that place. That is part of their function. In your intestine, everywhere you have some bacteria. Now,
What do women do? What do they do that can cause it?
okay, so when these bacteria are overgrown, they become a problem. Now, the one common thing that usually causes an overgrowth of the bacteria in the vaginal region is when the pH is affected. Now, what will make the pH to be affected? Number one is dosing. You know this thing. Sorry? Okay, so pH is the normal I don't want to use another big term. Like the normal temperature or normal the normal atmospheric temperature is not supposed to be too hot, it's not supposed to be too cold. It's supposed to just be at that point where it is acidic, so that anything that is trying to pass, it will just fry it off. That is part of the natural defense. Yes. So when somebody is washing, we have these very people that they are very hygienic and they have become hygienic to default. the one thing that can easily affect that pH and also cause overgrowth of bacteria is using soap. So if you want to avoid it, you have to ensure that you are not using soap around your vaginal area. All those you are not putting your hand inside. You are not spraying perfume. You know all this, I want to smell good under. They now spray perfume. You see, also something else that has also caused it, or that can also contribute to it, may also be as a result of sometimes the type of sanitary towels that people use. Hello ma, can you hear me?
Very well.
Okay, so the type of sanitary towel. Yes, then when people go and buy okrika pants, fairly used pants, then also buying pants from the shop without washing it.
Okay, but they only have money for okrika pants. They should at least get this one piece and then wash them, right?
Yes, pastor. Even if it is new pants, I was even going to say that even if it is new pants you buy, don't buy new pants and wear it straight. They can, you see, sometimes there are preservatives on these pants that can cause a reaction. Now this reaction may trigger abnormality in the bacterial load, and you know the symptom will be itching, will be irritation, will be discomfort. So the woman will quickly assume that, oh, I have infection, and then she will quickly go and be using drugs, using drugs, because it is not as a result of an external invasion, but as a result of practices. The person will not be seeing results. So you have women saying, I've been treating infection, infection is not going. They have almost turned infections to be immortal, like it doesn't die. Whereas the lifestyle that is causing it has to be stopped. Once it is stopped, the cycle is broken.
Okay, okay, so the question is, for young babies, can they, what to say now, when they have this infection, what can they use to treat it or prevent it? Do you have a solution for that?
Yes, pastor. So when people reach out to me to say, oh, they have an infection, so that's part of why, first of all, I just do like a 5 to 10 minutes consultation, like an assessment, to find out, okay, all right, to be able to establish that it is actually what we are dealing with. And then when we establish what we are dealing with, then we now prefer a treatment according to what the person is dealing with. If there is an overload, yes, you know, so if there is an overload, so in addition to the treatment, or to the during the assessment, usually I now usually provide them with information to break the cycle. Because whether it is a sexually transmitted infection or is a non-sexually transmitted infection, you have to break the cycle for it not to come again. So I provide you with treatment and I teach you what to do. And that's part of why I have a lot of videos on my page that people will watch, so that in each of the videos there is a home remedy of what to do. There is how to care. I have a video that I've done on how to care for your undies. What is the best way to care for your undies? It's not even about the amount. How do you wash your undies? Do you soak your undies for 1 month and wash it after 1 month? What is the implication of that? Do you just wash? If you are going to use a detergent, you know, because people focus more on rinsing. Another thing again, pastor, that can be triggering infection is the quantity of soap that is used in washing their undergarments. because they wash so much, they now spray additional flavor thing to make the pants smell well. They now hang it in the bathroom. You see, these habits are things that would make they are called obstacles to cure. They may not allow them to get the results that they are expecting. So first of all is knowledge. The knowledge, like we're having this webinar now, this live show, they are getting knowledge on, okay, this infection that is I'm dealing with. And you know, when infection has stayed so long in the body, it now moves from the vagina, moves to the fallopian tube, it just moves to the cervix, to the uterus, to the fallopian tube, to the ovaries, and then at that point it becomes a pelvic inflammatory disease. And quite a number of people have PID. In fact, PID is one of the silent diseases, because at the time the infection ascends like that, there may not be symptoms anymore. You see, there may not be symptoms anymore, and so the person may not know. And when left untreated for many years, it becomes one of the leading causes of primary or secondary infertility. Some women, after their childbirth, the process of childbirth, then they found out, then they picked up an infection, or during that process there was an infection, you know, something, and it has not been resolved. It just spreads, and then they find out that they are not able to conceive again. They are taking hormonal drugs. They go and say, oh, your hormones are balanced, oh, there's nothing wrong with you. But they may not have done a very essential test to know that they have this PID. And one of the simple ways to know that someone has PID is an abdominal scan. When somebody runs an abdominal scan, it will show that there is a collection of fluid in the pouch of Douglas. Now that collection of fluid there is like pus, that when somebody has a boil in their hand or somewhere, it's like a pus. So there's a collection of fluid. It is always an indication that there is a bacteria. And so when that is found, we now want to isolate which particular bacteria are we dealing with. Are we dealing with trichomonasis? Are we dealing with chlamydia? Are we dealing with gonorrhea, staphylococcus? All these things are things that can, is it a, you know, so, or is it a combination of different bacteria? So by the time they do this test, it now determines what is the way to break the circle. If you do any treatment and you don't know how to break the circle continues endlessly. It's a circle. But the knowledge of what to do and how to disinfect your house while treating, while you are treating yourself for infection, you must do it disinfection. How do you disinfect your mattress? Because your mattress that you have been lying down on, some of them have dropped, some droppings are and you see, Pastor, some people have children, they're always having eye itching, irritation. It is sometimes from the infection from the mother, because the children are closest to the mother. So at those young and tender age, the child, it's easy for the mother for a bacterial infection from the surface can just easily get to the eye, to the mouth, to somewhere, and you know the circle continues. The husband has it, the children has it, you know, but her own is in her vagina, but for the child is in the ear or the eyes or the nose. So it's important in the course of treatment, you must know how to disinfect. These are important things that you must know how to break the circle. Thank you, ma'am. Okay, okay, I don't know how to add the product to this video, but oh wow, okay, please can you get me one of the Women Matter pack and the antibiotics? Yes, so we have this Women Matter pack. Yes, now the Women Matter pack deals with women related issues. In that combo actually helps to deal with the vaginal issues, helps to deal with menstrual problems, helps to deal with hormonal problems, then as well as in it helps to deal with the woman mind. It's calming also. In it is an antibiotics. Now these antibiotics deal with the infection not only in the vagina but from the ovaries to the tubes, to the fallopian, to the uterus, to the cervix. It will bring everything down out. So usually when people use it, they find that they begin to have some draining. They begin to drain. So after the draining, then they begin to now have normal healthy discharge. Then for women that have dryness in their vagina, it helps, then the elasticity of the vagina also is, it also works in it. And then for women who are trying to conceive, we've had a lot of cases of people using this combo and they find out that, after using, they get pregnant. Because of course, the hormones have been balanced. These infections sometimes can affect their menstrual cycle. Some of them will now begin to have irregular menses. So this combo helps to regulate their menses. It also helps to, yes, they are bringing it, yes. They are bringing some part of the combo. So it helps to regulate their menses, helps to regulate their hormones, helps to remove infection. So it's a pack that has different of the products. And by the time they use it, so it's a 3 months. So the first month we're dealing with the infection. The second month we're balancing your hormones and balancing your female system. The third month we're preparing your uterus. So for a woman, by this third month of using it, she's calling to say, I'm pregnant. I've missed my period. Because they have gone through it. And so for some women, they just say, no, my hormones have not been affected. It's just it's just the infection. Once the infection that is the cause of the problem is removed, immediately they find out that, they can conceive. So the Women Matter combo deals with the issues, and then sometimes there may be some issues that the woman may not know, because either it is in the formative stage or it is not yet advanced enough for laboratory to pick it up. One of them could be very microscopic sizes of fibroid. Now, it may be too small for it to be picked up, but during the course of the therapy, it would just generally flush, because there will be a shedding off of the layers of the uterus, so that a better and a more suitable one to allow for implantation along from when fertilization takes place, from when the egg is released, the environment is safe for the egg to stay. When the sperm goes in, the environment is conducive for the sperm to pass. It won't die off, it won't be killed. When fertilization takes place, it makes it possible for it to be implanted. And that's about it. So this is one of the products. This is the Women Matter. Yes. So this is the one that does the shedding and all that. Then there's the antibiotics. Then there's the one that calms the mind, so that the emotion, because the uterus is an emotional organ. If you are very sad and unhappy, it will affect your uterus.
All right. Now, something, what I come about NP father is that actually nice to me. I was reading Bible, Deuteronomy, when God was giving Israel the law. He talked about how that, in fact, God tried this thing of washing. Wash your hands, wash. And then because Israel were in the wilderness, they were moving to the promised land. They are not reached the promised land. It means that the body of a number of people, thousands of people, maybe millions actually, and having to keep them in camp without disease breaking out, that was in itself a miracle. But then they had a part to play. They were strict laws on how to be clean,
yes,
when to educate, how to even them. In fact, God is so amazing. He gave them instructions of how they should wash with water.
Yes.
If anyone is their period, go separate yourself. They have to go separation because of passing on of bacteria and stuff like that. So everybody wash. If you touch a dead animal,
you wash.
Bacteria feed on dead
Yes.
You are unclean to eat because you have to wash and stay away from everybody. So because they were outside of stationary place, when as it were in the wilderness, God had to give them laws of cleaning. So also women, women need
Yes.
Naomi, the mother-in-law of Ruth, was sending her to Boaz. I mean, this was going to be an opportunity that they couldn't afford to miss.
Yes.
What did he tell her? She said, wash. What did she say?
Yes.
She said, so wash has to bring it must become clean. You cannot just wash and if you wash, you're still smelling that you are not washed.
Yes.
If you people say it's my body smell. Nobody wants to smell your body smell. If you wash and you find that you're not still clean, let me tell you, why will you wash yourself? Naomi said, wash yourself. Then he said, anoint yourself and put on your best garment, put on a perfume. Smell good, smell nice. Let your hair smell nice. Don't let when you remove your wig, fly is following you. Or smell good, and put on good garments. Wash your clothes, wash your undergarments, put them out in the sun.
Yes.
Dry. Don't keep them in your bathroom because your bathroom is not moisture around. It's going to encourage the growth of bacteria. Let the sun. Now that we have sun in Nigeria, let the sun get to it. Let air get to it. I'm sure it's quite dry. I have a friend who is supposed to have to iron her arms, but she's not very sure that it's very dry. She irons it. Although it makes no snag on time, but then she was always very confused about her body. So ladies, you've got to do much more than what you're doing today. You want to take care of yourself. Especially when you're someone that eats spicy food. This spicy food can go to bring out some stranger smells. So you'll be extra man to be clean. Because you are a lady, you are a woman of God, you are a special woman. So that is for that. Now, so I want just to share with us some more. For someone that has PID, what are the symptoms to look out for this kind of infections?
Okay.
What are the symptoms?
Thank you so much, Pastor. Now, so the first thing about PID is that in most cases, it doesn't have any symptom.
Wow.
Yes. And that's why it can go on for so long, because it doesn't produce any symptom whatsoever. But one of the signs of PID is waist pain. Waist pain that radiates to the leg. Yes. The pain radiates most time downward. The pain is not relieved by sleep or any activity. Sometimes there will be chest pain. Also, there will be general fever and feverishness. There will be feeling of tiredness and weakness. Now you see, the symptoms are not anywhere down there. In fact, most times the person will be treating low immunity. The person will be treating malaria. Because, so the pain is in the chest, the person will be treating ulcer. And usually the pain may be more when the person is hungry. Yes. So it mimics ulcer. So, but one key thing is that it is waist pain. And then the person has some times where there are abnormal temperatures. Like it could be for some people, it could be every afternoon they'll be catching cold. Then when the sun is hot, so the weather is hot, they are catching cold. The weather is cold, they are feeling hot. So these are some of the symptoms. When a woman comes to me, and then in some cases the menses begins to get scanty. In other cases, the menses become irregular. So at some other point, the person will begin to have headaches. So all these things, these symptoms I just listed, are some of the symptoms that are associated with pelvic inflammatory disease. But in like 40 to 50% of the cases, they may not experience any symptom, But in 100% of the cases, when it becomes PID, there is nothing happening down there in the vagina. So the person is not relating these things to it. So you send them to go and do this test, and I say, when I send you to do tests as a female, I say, okay, fine, let's do a liver function test, let's do a kidney function test, let's do an ESR to check for a general inflammation. Because if the person checks their white blood cell, if they do a full blood count, they'll find that their white blood cell level is very high because of the presence of the infection. So yes, so when they do their full blood count, you find that. So and then they do a liver function test, and then I ask them to do an abdominal pelvic scan to check their abdomen, check their kidneys, because these symptoms are not specific to, they are also symptoms of liver issues, they are also symptoms of kidney issues, they are also symptoms of low immunity. But honestly, when we just find that there is fluid in the pouch of Douglas, I don't treat liver, I don't treat kidney, I just treat that infection first, and we find out that after like 5 days, those I'm feeling tired, I've not gotten myself since. And then there's this, I've not gotten myself since I had one infection, or I had one thing that had to do with an infection like 2 years ago. I've not gotten myself. If I go to the hospital, they keep saying infection, I'm using antibiotics, it's not going. It's no longer just an infection. It has now become a pelvic inflammatory disease. And sometimes this thing can cause the fallopian tubes to gum together, cause adhesion. That's why it is a leading cause of infertility in women, because in fact, in some cases, it could lead to ovarian cyst. Not in all the cases, but in some cases. So those are some of the symptoms. Sorry?
It's treatable, right?
Yes, it is treatable. First of all, by doing assessments. Second of all, running the tests, because we don't want to assume that, oh, it is just, we don't want to assume that it is just we don't yeah. So I'm always very sure if I'm treating someone for PID, they know that it's PID, and most times they've already gone to do tests have shown them that they have PID. They have probably been treating it for like 2 years. It's not going. They've not gotten themselves. And then at night they begin to have sometimes internal heats.
Wow.
Yes, ma'am.
Now, Pastor Rita, comes and recommended. I mean, you use organic products, you use herbs, I mean, natural herbs that God has given to us in foods that we have around us. There's some foods that are herbs, there's some natural herbs that we use. I'm trying to hear online to know that some we following one of God Pastor we hear the kind of spirit, the evil that the deep state pharmacare is involved in. You just want to be careful. See, Dr. Rita is someone that is an authority in the use of natural herbs, and has prevented a lot of these diseases from women, and also has treated them out. And she comes highly recommended, and she has an showed you one of her products, and she has several products. And she has a company that produces teas that prevent of diseases. You know, she also has tinctures and that treats certain matters, even up to cancerous diseases. You know, so I'm just talking about she, and she is well trained. She's not just practicing. She's well trained. She's very professional about it. So this thing that she's saying is very important. Pay attention to them and take care of matters, even up to cancerous diseases. You know, so I'm just talking because she and she is well trained. She's not just practicing on her own. She's well trained. She comes very professional about it. So these things that she's saying, yeah, it's very important for you to pay attention to them, and to take care of yourself, because it is when you are fine, when you are all right, that you can take care of others. It's when you are functioning perfectly that you can serve God fully.
Thank you
You
so
can
much,
do
Pastor
His
Ma.
will.
So I
If you're
just
not
like to
okay,
just
you're
quickly
not
add
all right, how will you do what
that
person should
the care
do?
of the buttocks,
So if you are praying for children,
very important because of the proximity between the anus to the vagina. So in when women have their bath, they need to ensure that they wash their buttocks, wash underneath their bum bum. We sit for so long hours. The weather is very hot nowadays. There is accumulation of sweat, and then some of the tissues down there because of the sweat. So it's good that you use, while you don't use soap for your vagina, you should use soap for your buttocks and wash under your butt cheeks, under, always wash. Then in between put soap. But when a woman has very long nails, how is she going to put her hand there and wash very well? That's the thing. And then so so sometimes, and then in cleaning up also, I must say this, because a woman can infect herself. A woman can infect herself by cleaning wrongly. Ideally, you should wash from front to back, not from back to front. So in washing your bum, even when you are washing your bum bum, ensure that your hand doesn't cross behind. You don't go from your vagina, you go from your butt. And it's very wise that you squat down. In squatting down, even if you are washing properly, the flow of water when you wash, fecal matter can flow forward, and a fecal particle will just stay down there and move upward. You have infected yourself. The husband will not be positive, the wife will be positive, because there is a fecal particle in the vagina. That in itself is going to trigger a lot of problems for the woman. Now, so in washing, ensure to squat properly, bend down and wash and rinse properly, ensuring that it doesn't rinse forward. Then also, I just want to say, it is not hygienic to carry long pubic hair. Yeah, but it's not, pastor. Some people's pubic hair is very long. You can pack it all back.
okay, that's fine.
They can use rubber band and pack it into shuku or any style.
That's fine. That's good. Again, you see, thank you so much for washing properly, keeping long nails. These are very, very important for your body to prevent infecting or even infecting ourselves. It's very, very important. Thank you very much for this introduction. Because we are having wow. I've been on with Dr. Rita for faculty, just sharing and talking about. I hope learned or things I've learned. Like I said, she has some products. You can get in touch with her at Ask Dr. Rita. She's on Instagram and
Thank you so much. Ask Dr. Rita show.
Yes. And if you have questions, you can send questions or comments. You can also come to my page
Yes.
and share your testimonies. I like to hear your good stories. You tell the Rita your problems. You share with me your life stories.
Yeah.
Your testimonies. I like that testimony. And of course, you can post as well as well. Thank you so much for being with us.
Thank you so much, ma.
Thank you.
Thank you,
So
ma.
how are you doing?
Yes, ma. Bye. Bye, ma. Thank you, ma. Okay. So, are they still live on YouTube? How many people are there? Hello, my YouTube people. Are you there? Can you see me? Can I see you? Let me try and go on YouTube so I can talk to you. You can talk to me. Can you hear me, please? Kindly comment and let me know, where are you watching me from? I was live on Instagram and I'm now back with you here. Thank you so much. So I'm going to take your questions now. Let me go to YouTube and I'm trying to log in so that I can see your questions and respond to them. Okay. Thank you. I'd like to know who is watching. Who is watching? Please let me know if you're watching. Where are you watching from? Did you hear me? Was there something I said you didn't understand or you didn't hear? And then those of you in my Women Matter class, can you please ask any question you have now? Are there questions? Okay, 5 people watching. Okay, so this class is on vaginal infection and pelvic inflammatory diseases, and I am not seeing questions, but I'm going to answer a question that I got. I'm going to answer a question that I got on the this morning. I got this question this morning from a pastor. She said, prolonged infection that refused to finish. Yet the result says the husband does not have. Is it possible for the woman to have infection and having sex with the husband, and the husband will not have the infection? This infection has lasted for 28 years. Wow. I wish this person is online now to see and hear what I'm saying, but now there are different types of infection. There is the bacterial vaginosis, there is trichomonas, there is gonorrhea, there is vaginitis, there is bacterial vaginosis. Now, there is what you, so infections are categorized into two. There are contagious infection. Those are infection that you can have and spread to your partner. Your partner can have and spread to you. There are non-contagious infection. Those are infections that you can have and your partner will not have it. So to answer this question here, that is it possible for the woman to have infection and having sex with the husband and the husband will not have the infection? Yes, it is very possible. It is possible for a woman to have what you call non-contagious infection. Now, in the month of March, I spent a lot of time dealing with different vaginal infections. If you go on this page, they would have been uploaded. But if you go on the Instagram account, Ask Dr. Rita Show, all the videos are there and what you can do about it. So, madam, if you have had this infection for 28 years, I can say that this infection is not in the same form that it was. It certainly has changed form. So, I would really say that you should come and reach out to the office and let's give you our antibiotics. This is the antibiotics I was talking about. This is the antibiotics I was talking about. The Women Matter combo has this, it has this in it. Now, these products together help the woman to deal with infection, to also deal with the complications of the infection. Very, very important. Very, 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 very important. Now, I've done a video on pelvic inflammatory disease. So if you watch the video, there are home remedies I gave to you, not wanting to say the same thing over and over. But I'm just going to talk briefly on the breaking the cycle of vaginal infection. How do you break the cycle of vaginal infection? To break the cycle of vaginal infection, what you need to do is to first of all know, is it a contagious infection you are dealing with or a non-contagious infection? Now, the second thing you want to also know is this infection that you have, how is it affecting your health generally and locally, in the sense that this infection, is it already affecting your immune system? Is it already affecting, because PID can cause liver inflammation. I'm telling you the truth. PID can cause a woman to have abdominal discomfort, upper abdominal discomfort, lower abdominal discomfort, discomfort at the sides. That the person may be thinking they are having kidney problem. You see, so these are things that somebody may experience. So, okay. So these are things. So how do you break the cycle? How do you break the cycle of a vaginal infection? You need to disinfect yourself, your house. You need to disinfect. Very important. You need to disinfect your towel, your bed sheets. You need to disinfect. Get a jig. Get hot water. Put them inside the jig. Put your boil hot water inside a bucket. Pour jig, like a cover or two cover in it, depending on the quantity of materials you want to disinfect. Then put them inside. Put the jig in the hot water. Then put your cloth in it and leave it in it till the temperature will become tepid for you to be able to rinse it out. This is after you have finished washing. So in disinfecting, it's not pouring jig inside your washing water. No. What you want is to disinfect. So your undies has been washed, and then I need to say to you that you need to rinse properly. You need to rinse much more. The water from your rinsing of your undies or your towels must be clear water. You rinse to the point that it becomes clear water. No single foam must come out of it. This is part of disinfection. Because if you remember, the chemical from your soap in your undergarment can cause a reaction that will trigger abnormal bacterial population in your vaginal area. There is a condition known as bacterial vaginosis where there is overgrowth of the bacteria there. If a woman has bacterial vaginosis, her husband will not pick it up. It's not said, she only her will be positive for infection. Her husband will be negative. Her husband will be positive when it goes to do oral sex. He will pick it up from the vagina in his mouth and swallow it and go and give himself another level of. That is for next week when we are dealing with oral sex. You see, so you want to ensure that you are disinfecting properly. So you finish rinsing properly, then you disinfect with your jig, then you rinse it out from the jig. When you remove it from the jig, you rinse away the jig water. Please don't spread it with the jig. No, you rinse away the jig water. Then you spread under the sun, hot sun shining. Then you must pack your undies when the sun is still shining outside, not when the sun has gone down. You sun it in the morning, then you are packing it by 6:30 when this everything, what has happened, dew has come on it, it becomes damp. You take it inside your closet. What happened? Fungus, the moisture allows for fungus from the air to be able to affect. So it is important that you as a person, you ensure that you are breaking the cycle of infection. So that is I don't know if there's any other question, but that was the question I have. And if there's no other question, I think I'm going to be wrapping up now from this program. So I hope you have learned something very good. I hope that I've been able to answer your questions, and I would see you next week as we go live on oral sex from the medical perspective. Oral sex from the medical perspective. You don't want to miss that. It's going to be the bomb. So, permission to sign out. Don't want it to exceed 1 hour. If there's no question, thank you so much, Pastor Nike. Thank you, Brilliant Tare. Those are the 2 comments I'm seeing. And any other person that is online watching now, thank you so much for watching, and get ready for the program next week as we deal with oral sex. I'll see you. Take good care of yourself. Bye. Thank you very much. Have we signed out? Okay.